Hi, I'm Dr. Martina Bestikova, and you're about to view a short video about your baby from the doctors here at Washingtonville Pediatrics. Let's start with a look at how your 12-month-old is developing from our friends at Simply Parenting.
Happy first birthday! As if your baby is telling this news to the world, you may have noticed that he or she will not stop jabbering. 1-year-olds are big into communication. By now, your baby has emerged as a full-fledged social butterfly who will look you in the eye, give kisses, and try to make you laugh. Your baby can now understand some of what you say and respond with words and gestures.
One open.
Your 1-year-old will even initiate conversation by letting you know what he or she wants and needs. And gradually, baby talk will be replaced with real words, even if only you can understand them at first.
Apple. Yeah, apple.
By 12 months, your baby will also begin to communicate feelings of anger. It's unlikely that he or she will have a full temper tantrum at this age, but your 1-year-old may express frustration at being restrained or disciplined. Diapering, for example, will be more of a challenge because he or she will want to scurry around. During these bouts of anger, try distracting your baby with a toy or a new activity. And don't be afraid to say no if your 1-year-old is behaving inappropriately. You may see a strange look in your baby's eyes, but this means you have begun to set limits. Your 1-year-old can now pick up objects and release them to you. At this point, be prepared for the drop things on the floor game. Your baby's not being naughty when he or she does this, just practicing the grab and release technique called casting. Another challenging activity is your baby's newfound interest in emptying containers, including garbage pails as well as opening cabinets and taking out the pots and pans. He or she is mastering this new concept of what's inside, although it's guaranteed to make a mess. Although some children won't take their first steps until 15 or 18 months, by 1 year, most children will at least be experimenting with balancing on their feet, either using your hands or furniture for support. This is called cruising. When they finally begin to toddle on their own, watch out. They'll wander off and explore everything. Keep in mind that your baby's first birthday marks the beginning of a new era of mobility for your child. Ease your anxiety by moving dangerous or valuable objects away from your baby's reach. Then let your baby go explore.
The big change for your 1-year-old is the change from formula to whole milk. But too much of a good thing can lead to anemia, so limit your baby's daily milk drinking to no more than 16 to 24 ounces. Of course, if you're breastfeeding, you can continue nursing several times a day. Your infant should be having 3 meals a day, now with increasing amounts of table food and less jarred baby food. You can add eggs now, whites and yolks, but it's still good to avoid peanut butter, honey, and all nut products. To avoid choking, remember to cut up all foods into small pieces and avoid hot dogs and grapes. And never let an infant eat without an adult present, and never let an infant run around the house with food in his or her mouth. Infants do not need juice, and drinking too much juice can decrease a baby's appetite for other more nutritious foods. Establishing a regular bedtime and bedtime routine is very important. Your baby still needs 12 hours of sleep a night and should still be taking 1 to 2 naps a day. Expect more urgent protests when your active 1-year-old is put to bed. But remember that an overtired infant will be more irritable during the day and have more tantrums. So it's okay to let your baby cry and fuss a bit when placed in the crib. Most babies will fall asleep within a few minutes if left alone, especially if you have trained them how to go to sleep on their own. If your baby wakes up in the night, go in and comfort briefly, calmly, and without lights. If you haven't lowered the mattress in the crib yet, do so now. It's time to start using a sippy cup and be weaned from the bottle. But remember, no cups or bottles to bed. Teeth should be washed with a washcloth or very soft toothbrush at the end of the day. No toothpaste is needed yet. If your baby is uncomfortable from teething, acetaminophen will be very helpful. Check with our staff for the correct dosage for your infant. Continue polyviflor daily unless your water is fluoridated. Now let's review some safety tips.
Follow these tips to keep your baby safe and sound. At 12 months, your child is now very much on the go, reaching higher, grabbing harder, and moving faster. So follow these important safety tips. Baby-proof everything. Get down on the floor and begin to crawl and toddle around your home. See your furniture as your child sees it. Learn what he or she can reach, open, and feel. Install safety latches on all drawers and cabinets, including the toilet. Be sure to cover all electrical outlets. Add bumpers to furniture with sharp edges. And remember to place a gate at the top and bottom of the staircase. Prevent danger from poisoning. Keep the number for your local poison control center next to your telephone. In general, just always try to be one step ahead of your baby, soon to be a toddler. Be consistent and be firm when your child's safety is at risk. Remember that with each stage of growth, protecting your child becomes more challenging. Let your baby explore, but always under your watchful eye.
Hi, my name is Colleen. I'm one of the nurses here at Washingtonville Pediatrics. Now here's some advice from our nursing staff. Remember, never give any medications to your baby unless instructed by your doctor. And no cold medicines should be given to your baby at any time. Here are some reasons to call the office. If your baby has a fever with temperature 102 or greater, if your baby has a fever of 101 or greater persisting more than 24 hours, if your baby is more irritable than normal, if your baby is not waking to feed or is refusing to feed, if your baby's vomited more than once, if your baby has a severe cough, wheezing, or is breathing faster than normal, or if your baby falls and hits his or her head hard, especially if there's any loss of consciousness or there's a visible bruise or bump.
Now, let's have some fun with your 1-year-old.
Dog, I know.
Now that your 1-year-old is starting to talk, take the time to teach him or her new words.
Cat, turtle.
Boo-boo say brown.
Board books can help teach your child names of items that aren't in your home or neighborhood. As your baby learns to walk, he or she will enjoy toys that can roll, pull, and push, especially ones that make noise. Also, now that your 1-year-old has gotten better at using his or her hands, try assembling simple puzzles with your child, as well as stacking blocks, playing with hammering toys, and exploring your baby's inner Picasso with chunky crayons. A plastic bucket filled with blocks is a great way to teach your child the concept of containers. Let him or her take the blocks out of the basket and then put them back in again. If you don't have a toy bucket, keep in mind that simple household items can make a child just as happy. Perhaps the favorite activity for a 1-year-old is casting. Babies eventually grow out of this behavior, but hey, isn't it just a little satisfying to see that playful smile?
Thanks for watching. We'll see you back when your toddler is 15 months old.